afternoon, everyone. My name is Nancy Weaver, and this is my PowerPoint, Unifying Vision, Strategies that Influence Nurse Self-Care Practices. This PowerPoint represents my quality improvement project for the Doctor of Nursing Practice program here at Jacksonville State University. I would like to thank all of you in advance for allowing me to participate in disseminating this project today. A needs assessment resulted in an internal evaluation identifying nursing turnover rates as a clear indicator of the pending crisis for our clinic. From a nursing perspective, the labor market continued to tighten, with 59% of hospitals alone projecting to increase their nursing staff. Nationally, the current vacancy rate stands at 9%. Approximately 1 in 5, 19.3% of hospitals reported a nursing vacancy rate of less than 5%. In comparison, a third, 31.8%, reported a vacancy rate exceeding 10%. Self-care is a lifelong habit that individuals engage in to take care of themselves. It is in a broader concept encompassing hygiene, nutrition, lifestyle, physical, mental, and spiritual health, and other dynamics that come into play, such as environmental and socioeconomical factors. Often it is difficult to find the time and energy to take care of oneself. However, nurses who practice self-care report less stress. As we'll see in a moment, studies have shown that high levels of stress can lead to exhaustion, fatigue, tension, and of course, burnout. The World Health Organization reports that during COVID-19, nurses exposed to high stressful conditions that threatened their health and well-being severely affected their ability to work. Nurses' reactions to the stress of the current pandemic must be viewed from an occupational health and safety perspective. According to the WHO, the shortage of nurses will interfere with national and international efforts to optimize the health and well-being of our global population. In 2021, the COVID-19 pandemic, the WHO declared burnout as an occupational phenomena rather than a medical condition, characterized by feelings of exhaustion, disengagement from one's job, and a sense of diminished professional fulfillment. Burnout is considered the result of chronic work stress that the individual is not able to manage. The onset of the COVID-19 pandemic has increased stress among an already strained nursing population, putting their mental health and well-being at risk. In a 2020 report, researchers related high levels of depression, stress, and anxiety could lead to post-traumatic stress disorder in healthcare workers. These findings offer evidence-based support for this quality improvement project. The purpose of this project aimed to create a website presenting creative strategies that encouraged a healthy lifestyle and teach nurses how to engage in self-care practices. Through interviews with executives at a privately owned multi-specialty physician clinic, stakeholders identified the need for easy access to information supporting nurses' ability to practice self-care. The objectives for this project were to first develop a website containing creative strategies that support a healthy lifestyle and encourage nurses to engage in self-care practices. Secondly, to educate nurses on how to access and use the website. And thirdly, evaluate the use of the Unifying Vision website. A project-focused question was created using evidence-based practice framework to keep the project on target. The PICO question: in currently employed nurses, will the use of a website on self-care strategies for nurses versus not using the website increase awareness of self-care practices among nursing staff in a multi-specialty physician clinic? Dorothea Orman's theory, known as self-care model, was used as a theoretical framework for this project. Orm's self-care deficit theory of nursing is composed of three interrelated theories: the theory of self-care, the self-care deficit theory, and the theory of nursing systems. Orm's theory focused on an individual's ability to perform self-care, which is described as the practice of activities that individuals initiate and act on their behalf to maintain good health and overall well-being. This student performed a systematic review of the literature to ascertain the effectiveness of self-care strategies for nurses. The literature review sought to evaluate current research on the relationship between nurses' self-care practices, healthy work environments, and the effects on patient outcomes. Studies support the notion that a nurse's lack of self-care can significantly impact their engagement and an organization's ability to retain competent staff. In a recent CDC report, the CDC informed the public that the current COVID-19 public health crisis has made it more critical than ever for one to take time for oneself, stress prevention, and engage in healthy coping strategies. In a 2016 report, it showed that nurses must have the necessary tools to engage in stress management. Crane and Ward 2016 research showed that organizations' human resources are a valuable asset and also shed light on the importance of supporting a healthy work environment for employees. In a 2018 study, researchers concluded that the nurses' physical, emotional, and social dimensions of self-care practices could reduce the adverse effects of a less than optimal situation. These findings signify that it is essential to investigate the constructs of self-care to mitigate the emotional demands in a highly stressful environment. Another study, Stige and Rainbow 2016 study, clarified how nurse fatigue and nurse professional attributes affect nurse retention and job satisfaction. Research studies demonstrate a significant value to an organization and individuals when it comes to educating nurses about self-care. In a 2019 survey, the researchers concluded that nurse burnout contributed to the lack of quality patient care, with 56% of those nurses surveyed stating that they felt their organizations were ineffective at addressing these issues. Other research studies found that nurses who self-report high levels of stress also experience increasing levels of pain and depression. Further correlations were made showing that these nurses were less likely to be engaged with work activities, leading to increased patient falls, medication errors, and decreased quality metrics in general. The Plan, Do, Study Act model for quality improvement was used for this project. The Pdsa model is a systematic process created by Dr. W. Edward Deming that applies a staged approach that improves the quality of processes and ensures the best outcomes. Going through the prescribed 4-step guides the thinking process into breaking down the task into steps, evaluating the outcomes, improving on it, and testing again. The site was appropriate because of the large number of nurses working in high-stressed areas in the clinic. The clinic has more than 250 healthcare professionals who provide integrated care across more than 40 specialties and services. Executive leadership expressed concern about stress and burnout among their healthcare professionals. The leadership team recognized that self-care practices among their nursing staff could directly affect patient safety, satisfaction scores, and staff well-being. This was a significant concern as the clinic experienced a staffing shortage because of the raging pandemic. Healthcare personnel shortage continued as the COVID-19 pandemic progressed. Direct and indirect exposures to COVID-19 or the need to care for family members contributed to an already challenging predicament. An educational offering that aimed to influence nurse self-care strategies was developed. 15 15 nurses participated in the project, where they were introduced to the Unifying Vision strategies that influence nurse self-care website. The discussions that followed emphasized the evidence-based research findings related to strategies that can influence self-care practices. Participants discussed self-care strategies in guided conversations. Participants gained new knowledge about self-care practices and discussed how these practices could possibly affect patient outcomes. A peer-to-peer discussion regarding the usefulness of the website provided participants the opportunity to explore strategies that could potentially enhance self-care practices. Finally, a written post-implementation questionnaire was given to evaluate the Unifying Vision's website and determine whether participants increased their awareness of self-care practices. Information also shared regarding the Unifying Vision website addressed for future references. The instruments used in this project were the Wellness Assessment Scale and the Unifying Vision Pre- and Post-Implementation Questionnaire. The Unifying Vision website presentation, combined with a corresponding detailed explanation regarding the website, introduced participants to these strategies that could influence the self-care practices of nurses. A convenient sampling was used to recruit professional nurses currently employed at the project site. This population included nurses from various demographics, backgrounds, experience level, educational levels, and lifestyles. The majority of the nurses held an associate's degree and an average of 3 to 5 years of experiences. Nurses took the pre-test and post-test. Of the pre-test group, 66.7% reported that they did not currently use websites dedicated to self-care strategies. After the educational offering, 100% of the post-test group said that they felt the Unifying Vision website offered tools needed to practice self-care. They had more confidence in their ability to engage in self-care activities. The project participants also completed a second 30-day post-interventional questionnaire. Of the 15 original participants, 73.3% reported that they had visited the Unifying Vision website 11 or more times in the last 30 days. This slide just shows analysis in a pie chart diagram. This quality improvement project identified that the educational intervention positively impacted how participants viewed self-care and demonstrated an increased willingness to utilize websites to promote self-care. After participating in the session to learn how to navigate the Unifying Vision website, this group of nurses were much more likely to frequent the website and found it helpful in providing tools for self-care. This project validates the current research that supports self-care practices for nurses is needed. This DNP Quality Improvement Project concluded that a website containing creative strategies that support a healthy lifestyle and encourages nurses to engage in self-care practices is a valuable tool. Participants' response in the post-interventional questionnaire indicate that the Unifying Vision website is one that they would continue to use now and in the future. The project demonstrated that the development of the Unifying Vision website and providing an educational offering that aimed to influence nurse self-care strategies helped increase awareness of creative strategies that support a healthy lifestyle and encourage nurses to engage in self-care practices. Further implications, including expanding the information regarding the Unifying Vision website to all employees at the project implementation site, the companies and other facilities, as well as outpatient facilities in the area when the COVID-19 restrictions have subsided. The sustainability of this project will be achieved by a quarterly review of evidence-based articles regarding nursing self-care strategies. The Unifying Vision website will be updated quarterly if new self-care strategies for nurses are identified. The project facilitator will notify project participants and new staff via email each time the Unifying Vision website is updated. Thank you so much for allowing me time to share this quality improvement project.